Welcome back to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. We've reached the final episode of our journey together, episode 10. Over the past 9 episodes, you've gained essential insights and practical strategies to navigate utilization management. Now, it's time to look ahead, the future of utilization management in nursing. The healthcare landscape is evolving faster than ever. But instead of just reacting to change, what if nurses could lead the transformation? Dr. Nicolas Abella's final article explores precisely that, the exciting trends, powerful technologies, and evolving best practices that put nurses at the forefront. Get ready to be inspired. James and Emily are diving into Dr. Abella's vision for the future, exploring how innovations like AI and telehealth can become powerful tools in your hands, and discussing the essential skills that will empower you to not just adapt, but to shape a more efficient, effective, and patient-centered future for utilization management. This isn't just about keeping up, it's about leading the way. Here are your hosts for this exciting look ahead, James Carter and Emily Ramirez.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We are so excited you're joining us again as we jump into another
where we're focused on bringing you the insights and the tools that you need to truly thrive in your nursing careers.
Absolutely. And today we are tackling a topic that is so vital in healthcare right now, and one that's undergoing some really dramatic changes.
That's right. We're talking about the future of utilization management in nursing.
Exactly. We're going to be exploring how utilization management is being reshaped by all of these big shifts in healthcare.
You know, like the rise of these really powerful new technologies.
The evolving needs of our patients.
And of course, the growing emphasis on delivering value-based care.
Yes, and what we really want to highlight is how all of these changes directly affect you.
Whether you're working at the bedside providing direct patient care,
or if you're taking on more of a leadership role within your organization.
Exactly.
Now, to help us navigate this really exciting and complex terrain, we're going to be drawing insights from a fantastic article.
It's called The Future of Utilization Management in Nursing, Trends, Technology, and Best Practices.
And it's by Dr. Nicolas Abella.
Now, as we delve into this, the big question we want you to keep in mind is this.
Are you ready for what the future holds for utilization management?
Because we really believe that by the end of our conversation today, you'll have a much clearer picture of the trends that are shaping this field.
The technologies that are going to transform how we approach and the best practices that will really define success in this area.
So to kick things off, let's first take a look at why those traditional utilization management approaches, the ones that we've relied on for so long.
Why they're kind of struggling to keep up in today's rapidly evolving healthcare world.
Yeah, what are some of the limitations we see when we sort of stick with the status quo in UM?
Well, one of the biggest challenges is that heavy reliance on manual processes for so much of utilization management.
All that paperwork and those often time-consuming approval steps.
And as Sarkar and his colleagues pointed out back in 2017,
these manual methods can often be inefficient and, unfortunately, prone to errors.
Right, and we know that can take valuable time away from nurses actually being able to deliver care to their patients.
Absolutely. And another challenge that really hinders effective is this problem of siloed data.
Where patient information is scattered across different systems and it doesn't really talk to each other.
Right, and Giardino and Wadwa actually highlighted this back in 2023.
And when you have this fragmented view of a patient's healthcare journey,
right,
it makes it so much harder to see the whole picture.
And to be proactive in identifying potential issues or, intervening early when it comes to managing resources effectively.
And to add to those challenges,
we know that nurses, those at the bedside who have the most direct insights into a patient's needs and their care,
they haven't always been as involved in the utilization management process as they could be.
And that's such a loss because nurses bring that essential frontline perspective to...
Yeah, right. And Shanmugam's research from 2024 really emphasized that this limited nurse involvement is a missed opportunity.
Yeah, we're not fully tapping into the expertise of those who know the patients best.
And let's be honest, sometimes these older systems haven't been as transparent as they could be.
And that can make it hard for patients to understand what's happening with their care.
Exactly. And it can create challenges for the healthcare team as well.
So while these traditional methods might have worked okay in the past,
they're facing some really big hurdles now in meeting those ever-increasing demands.
Those demands for careful cost management, continuous quality improvement, and that truly patient-centered approach.
Okay, so it's clear that the way we've been doing utilization management needs an upgrade.
It needs to evolve.
And now we want to shift gears and look at those amazing innovations on the horizon.
The ones that have the power to revolutionize.
Yeah, and one area that Dr. Abella is particularly excited about
Is what he calls the AI revolution.
and that's artificial intelligence and machine learning.
Right.
So what is it about these AI technologies that's so game-changing for utilization management?
Well, what's really exciting is that AI and machine learning are moving beyond just, being theoretical concepts.
They're becoming practical, indispensable tools that we can use in right now.
Yes, and one of the most powerful applications of AI in this area is predictive analytics.
As Chen and their team explored in 2020, AI can analyze these huge data sets.
To identify patients who might be at a higher risk for things like, longer hospital stays or even readmissions.
Or even those potential denials from insurance companies for certain treatments or services.
And the key here is that AI can do this proactively before these things actually happen.
Wow, that's incredible. So it's all about anticipating potential challenges before they become bigger problems.
Exactly.
Can you give us an example of how this might play out in a real-world setting for our listeners?
Sure. So imagine a nurse is admitting a new patient to their unit.
Okay.
And an AI-powered system flags this patient as having a higher likelihood of needing post-acute care after their hospital stay.
So maybe they need to go to a rehab facility or receive some kind of specialized care at home.
Exactly.
Okay.
Now, this early alert allows the nurse to start those important discharge planning conversations much earlier.
So they can talk to the patient and their family about what to expect and start working with case management.
Right. And that helps ensure a smoother transition for the patient when they leave the hospital.
That's such a great example of how AI can really support nurses in providing better, more proactive care.
It's all about anticipating those needs and getting everyone on the same page early on.
So we've seen how this could work for a bedside nurse.
What about from a nurse leader's perspective?
How could they use these AI tools?
Well, let's say you're a nurse manager on a unit.
Okay.
You could use an AI-driven dashboard that shows you which patients are statistically more likely to stay in the hospital longer than initially expected.
Oh, so you can kind of see those potential bottlenecks before they develop?
Exactly.
That's so smart.
And with this information, the manager can then proactively review the patient's care plans.
And make sure they have all the resources and support they need to move towards discharge in a timely way.
Right. It's all about staying one step ahead.
Now let's zoom out even further.
And think about how AI could impact decision-making at the chief nursing officer level.
The CNO.
Yeah.
So how might AI support their work in managing resources and improving patient flow across the entire hospital?
Well, a CNO might decide to invest in an AI platform that can predict the hospital's resource needs.
Like how many nurses will be needed on a particular day, or, even how many beds will likely be available.
Exactly.
Wow, that's amazing. So AI has the potential to really help CNOs make those really big strategic decisions.
That ultimately impact the entire organization and how care is delivered.
This is really mind-blowing stuff.
It is, and it's just the beginning.
Beyond predictive analytics, what other AI applications are we seeing emerge in utilization management?
Well, another area that holds a lot of promise is natural language processing, or NLP for short.
NLP.
Now think about all the information that's contained in clinical notes and patient charts.
It's a ton of information.
It is, and a lot of it is unstructured text, which makes it hard to analyze.
Right.
But NLP technology can actually read and understand that text.
Really, it can make sense of all those doctor's notes and care plans.
Exactly. It can extract those key details.
So it can help us quickly identify things that are relevant for utilization management decisions.
Like, if a patient has certain risk factors or if they meet the criteria for a specific level of care.
So it's saving us a lot of time and effort that we used to spend manually reviewing all those charts.
Exactly.
And we know time is so precious in healthcare.
Absolutely. And another really interesting development is the rise of automated prior authorization systems.
That process of getting approval from insurance companies before certain treatments or medications can be provided.
Right. And as Bernstein and his colleagues discussed in their 2024 research,
these automated systems can potentially streamline that whole authorization process,
which often involves a lot of back and forth and paperwork.
Yeah, it can be a real headache.
It can, and it can lead to delays in patients getting the care they need.
But with automation, we can reduce those administrative burdens.
And hopefully make things smoother and faster for everyone involved.
Now let's talk about another major trend that's transforming healthcare.
And that's the telehealth transformation.
Telehealth is really expanding how and where care is delivered.
It's bringing healthcare beyond the walls of the hospital.
So how is telehealth impacting utilization management?
Well, for one thing, it's allowing us to extend care beyond the traditional hospital setting.
Okay.
So, for example, a bedside nurse might do a follow-up phone call with a patient after they're discharged from the hospital.
So it's a way to check in and make sure they're doing okay at home?
Right, make sure they understand their medications and answer any questions they might have.
And potentially catch any problems early on that might lead to a readmission.
Exactly. It's all about providing that continuity of care.
And how are nurse leaders using telehealth in their utilization management efforts?
Well, we're seeing more and more nurse managers implementing remote patient monitoring programs.
So they can keep an eye on patients' vital signs and other key health indicators even when they're at home.
Right. And that allows for early detection of any issues and timely interventions.
Which can prevent those more serious health events that might require hospitalization.
It's all about proactive care.
And for the CNO, how does telehealth fit into their overall vision for efficient and effective care delivery?
Well, a CNO might look at integrating telehealth into the hospital's entire utilization management strategy.
Because it can be such a valuable tool for providing support to patients after they leave the hospital.
Yeah, and even managing chronic conditions remotely, which can really reduce the need for costly inpatient care.
So it's all about providing the right care in the right setting at the right time.
Absolutely.
And this really ties into another important concept, the patient-centric approach to utilization management.
You know, focusing on what's best for the individual patient and their unique needs and preferences.
Exactly. So how is this philosophy shaping the future of UM?
Well, it's shifting the focus away from just managing costs
Okay.
and towards ensuring that patients are receiving care that's tailored to their individual needs.
So for a bedside nurse, this might mean talking to the patient about their preferences for things like
Medication schedules or, discharge planning.
right, and really listening to what the patient wants and involving them in those decisions.
It's about respecting their choices and empowering them to be active participants in their care.
Now, what role do nurse leaders play in creating this more patient-centered approach to utilization management?
Well, nurse leaders are responsible for establishing those patient-centered policies and procedures.
Okay.
So they might develop protocols that prioritize shared decision-making.
Making sure that patients are fully informed and involved in creating their own care plans.
Right, and also making sure that patients understand why certain decisions are being made.
Transparency is so important.
It is, and at the CNO level.
It's about fostering a culture where the patient experience is truly paramount.
Exactly.
So a CNO might lead initiatives that focus on increasing patient engagement in their care.
Because when patients are informed and involved, they tend to be healthier and more satisfied with their care.
We've talked about being cost-effective and meeting those individual patient needs.
Right.
Now let's explore the idea of the value-based shift in healthcare.
And how this model is impacting utilization management.
So what is value-based care and how does it relate to UM?
Well, the move towards value-based care models, which Struthers and his team wrote about in 2024,
It's really changing the incentives in healthcare,
it is. Hospitals and healthcare systems are now being rewarded,
not just for how many patients they see or how many procedures they do.
but for actually achieving those positive patient outcomes.
So it's not about quantity anymore.
It's about quality and efficiency.
And that requires a much more proactive and comprehensive approach to utilization management.
Because we need to make sure that we're using resources wisely to achieve those desired outcomes for our patients.
That's a really big shift in focus.
Is.
And to really make this value-based care model work.
Yeah, we need to have seamless interoperability and data sharing between different healthcare providers and systems.
As Huom and their colleagues emphasized in their 2023 research.
Breaking down those data silos is crucial for effective utilization management.
Because we need to have that complete picture of a patient's health history and their care journey.
To make those informed decisions.
You can't manage care effectively if you only see part of the story.
Right. It's like trying to solve a puzzle with missing pieces.
Now let's talk about an area that's increasingly recognized as having a huge impact on health outcomes.
And that's social determinants of health.
You know, those factors that can really influence a person's overall health and well-being?
Things like access to healthy food or safe housing.
Or reliable transportation or social support.
All of these things play a role.
So how do social determinants of health fit into the utilization management landscape?
Well, for nurses working at the bedside.
It's becoming so important to be aware of and identify those social determinants that might be impacting their patients.
Because these factors can have a profound impact on a patient's ability to recover and manage their health.
For example, if a patient doesn't have transportation to get to follow-up appointments.
they might be more likely to end up back in the hospital.
And what can nurse leaders do to address these social determinants within their strategies?
Well, nurse leaders can create systems that help identify these social needs early on, maybe by incorporating screening tools into the patient intake process.
So we can flag those potential issues from the very beginning.
Exactly. And nurse leaders can also build partnerships with community-based organizations.
That can provide those essential support services to patients who need them.
Right. Connecting patients with resources for food assistance or transportation or housing.
And at the CNO level?
It's about fostering those broader collaborations and recognizing that healthcare extends beyond the hospital walls.
So a CNO might champion partnerships with social service agencies.
To address those social determinants of health within their patient population.
We've covered so much ground today.
From AI and telehealth to patient-centered care, value-based care interoperability, and now social determinants of health.
Before we delve into the skills nurses will need to thrive in this new world of can you just briefly touch on the idea of precision utilization management?
Absolutely. Precision utilization management is really about bringing together all of those trends we've been talking about.
Okay.
It's about using data and technology to personalize care.
Making sure that each patient gets the right care in the right setting at the right time.
And it's about aligning our practices with those value-based care models.
So for the bedside nurse, it reinforces that patient-centered approach.
And for nurse leaders, it's about guiding and supporting their teams in this more data-driven, personalized way.
And for the CNO?
It's about ensuring that the hospital has the right staffing and resources in place to support this kind of precision care.
Now let's shift our focus to our amazing listeners.
The nurses who are out there on the front lines every day.
And let's talk about the essential skills that you will need to not just survive, but to truly thrive in this rapidly evolving world of utilization management.
So what does the Future Nurses Toolkit look like?
One of the foundational skills that we'll all need is data literacy.
As Stadhouders and his colleagues wrote about back in 2019,
Data literacy goes beyond just, seeing numbers on a screen or in a report.
it's about understanding and interpreting those numbers.
So you can use that data to make informed decisions about patient care and improve the quality of care that we deliver.
Exactly.
So what are some key data points that nurses need to understand when it comes to utilization management?
Well, things like lengths of stay or denial rates or readmission rates.
Right, and we need to be able to spot trends and patterns in that data.
So we can identify areas where we can improve.
Can you give us some examples of how this might play out in different nursing roles?
Sure. So let's say you're a bedside nurse.
Okay.
And you notice that there's been an increase in readmissions for patients with a particular condition.
Like maybe heart failure?
Right, with strong data literacy skills.
You can delve into that data and try to figure out what might be contributing to those readmissions. Maybe there are some gaps in the discharge education that patients are receiving.
Or maybe there's a need for more coordinated follow-up care after they leave the hospital.
So it's about using data to identify problems and then brainstorm solutions.
That can really make a difference in patient outcomes.
And what about for nurse leaders? How would they use data literacy in their roles?
Well, imagine you're a nurse manager and you're using a data dashboard to track denial rates for certain procedures.
Okay.
And you notice that there's a high rate of denials for a specific type of treatment.
Yeah.
Now, by digging deeper into the data,
You might discover that the denials are often due to missing or incomplete documentation.
which suggests that there might be a need for more training on documentation requirements for your nursing staff.
So you can use data to identify those areas where your team might need additional support.
And then you can provide that support to improve their practice.
And for a CNO, data literacy is essential for making those strategic decisions that affect the entire organization.
Right. A CNO might recognize that there's a need to invest in hospital-wide data literacy training for all nurses.
So everyone can develop those skills and use data to drive those quality improvement efforts.
And, of course, to enhance patient care.
Data literacy is definitely a core competency for the future nurse.
What other skills will be essential?
Well, in today's tech-driven world, technology proficiency is another must-have.
As Rose pointed out back in 2018.
This doesn't mean that you need to become a computer programmer or anything.
But it does mean that you need to be comfortable using those various technologies that are becoming so integral to utilization management.
Like electronic health records or clinical decision support systems.
Or even those predictive analytics platforms that we talked about earlier.
Can you give our listeners an example of how this might look in their daily practice?
Sure. So picture a nurse who's using a mobile app at the bedside.
Okay.
And this app gives them instant access to a patient's insurance information
Okay.
and any pre-authorization requirements for the treatments that the patient needs.
So they can make sure that all the administrative steps are taken care of.
And that the patient can receive care without any unnecessary delays.
That's a great example of how technology can really streamline things and improve efficiency.
And what about for a nurse leader?
How might technology proficiency be important in their role?
Well, let's say a nurse manager is leading the implementation of a new EHR module.
That's designed to make the discharge planning process much easier and more efficient for the nursing staff.
Exactly. They're championing that adoption and helping their team learn how to use the new system effectively.
And at the CNO level, it's about providing the resources and support.
To make sure that nurses feel comfortable and confident using these new technologies.
So things like training programs and ongoing technical support.
So everyone feels empowered to use these tools to their full potential.
So we've talked about data literacy and technology proficiency.
What other skills are going to be crucial for nurses in the future of utilization management?
Well, critical thinking is going to be more important than ever.
As Marshall and her colleagues wrote about back in 2017,
It's not just about following protocols or doing things the way they've always been done.
it's about being able to analyze those complex patient situations.
Anticipate those potential challenges that might come up related to
And then develop solutions that are based on sound clinical judgment.
and a deep understanding of each individual patient's needs.
Right. It's about being proactive and thinking several steps ahead.
Can you give us an example of how critical thinking might play out in a real-world scenario?
Sure. So let's say a nurse is caring for a patient who has multiple social determinants of health. Maybe they're struggling with food insecurity, or they lack reliable transportation.
Now, using critical thinking skills, the nurse recognizes that these factors
Could increase the patient's risk of having a longer hospital stay or even being readmitted after they go home.
So the nurse proactively reaches out to the case manager,
And they work together to create a plan to address those social needs,
maybe connecting the patient with community resources or support services.
to prevent those potential complications down the line.
So it's about seeing the bigger picture and recognizing those factors that could impact the patient's overall well-being.
And then taking steps to mitigate those risks.
And how is critical thinking important for nurse leaders in the context of UM?
Well, let's say a nurse manager is leading a case review for a patient who has been readmitted to the hospital several times recently.
Okay.
Now, this manager uses their critical thinking skills
To facilitate a discussion with the entire care team.
to try to figure out why those readmissions are happening,
Maybe there are some communication breakdowns between different providers.
or some gaps in the follow-up care plan.
By analyzing the situation and engaging in that critical thinking.
The team can come up with strategies to prevent those future readmissions.
And for a CNO, it's about fostering that culture of critical thinking throughout the entire nursing organization.
So nurses at all levels feel empowered to use those problem-solving skills to improve patient care.
So maybe the CNO incorporates critical thinking exercises into those training programs.
Or creates opportunities for nurses to share those best practices.
Now, even though we're talking a lot about data and technology and these analytical skills,
We can't forget the importance of communication and collaboration.
those human skills are essential.
Absolutely, as Boljek Samardzic and their colleagues wrote about in 2020.
Effective communication and collaboration are fundamental to good nursing care.
And in the world of utilization management, this is more important than ever.
We need to be able to communicate effectively with doctors, case managers, patients' families,
The entire healthcare team, really.
to make sure everyone's on the same page about the patient's care plan and any UM decisions that are being made.
Right, and to ensure that the patient's needs are being met in a coordinated and efficient way.
So can you give us a practical example of how this collaborative communication might work in action?
Sure. So let's say a bedside nurse notices a change in their patient's condition.
Okay.
Maybe the patient's vital signs are unstable, or their symptoms are worsening.
Now, this nurse uses their communication skills to clearly and concisely convey that information to the doctor.
Explaining why they think the patient might need a change in their level of care.
Maybe they need to be transferred to the ICU.
Or maybe they need a different treatment.
But by communicating clearly and proactively,
The nurse can help ensure that the patient receives the right care at the right time.
and prevent any unnecessary delays.
Now, what about from a nurse leader's perspective? How does collaboration come into play?
Well, a nurse manager might facilitate those regular team meetings.
Where everyone involved in a patient's care can come together and discuss the case.
Share information and perspectives and make those collaborative decisions about the patient's plan of care,
And this can be especially important for patients with complex needs.
where you really need that multidisciplinary approach to care.
And for a CNO, it's about establishing those clear communication protocols and fostering that culture of open dialogue and respect.
Making sure that everyone feels comfortable speaking up and sharing their ideas.
And that there are systems in place to support those collaborative workflows.
So even with all the technological advancements, communication and collaboration remain at the heart of good nursing care.
Absolutely.
And speaking of things that are at the heart of nursing,
Patient advocacy is another essential skill that will be even more critical in the future of UM.
right as Shanmugam emphasized in his 2024 work,
Nurses need to be strong advocates for their patients.
making sure that their needs are being met and that they're receiving the best possible care.
And this means understanding their rights
Navigating those complexities of insurance coverage.
and fighting for them to get the services they need, even when there might be roadblocks.
So how does this patient advocacy look in practice?
Well, at the bedside, a nurse might spend time educating their patient and their family about their insurance benefits
Making sure they understand what's covered, what might require pre-authorization,
and what options they have.
so the patient feels empowered to make informed decisions about their care.
And for nurse leaders, advocacy might involve working with the hospital's ethics committee.
To create guidelines for handling those ethical challenges that can sometimes arise in utilization management.
Making sure that patient well-being and those ethical considerations are always front and center.
And for the CNO, it's about creating that culture of patient advocacy throughout the entire organization.
Making sure that the patient's best interests are always the driving force behind every UMM decision.
We've talked about so many important skills and concepts.
And we know that the healthcare landscape is constantly changing.
So how can nurses embrace those changes and thrive in this dynamic environment?
Well, developing strong change management skills is essential.
Absolutely.
Nurses at all levels need to be adaptable and resilient.
And willing to learn new things and embrace those new ways of doing things.
Whether it's a new technology or a new clinical process or a change in regulations.
Being able to adapt to those changes is crucial.
So for a bedside nurse, this might mean quickly learning how to use a new piece of equipment.
Or adapting to a new workflow on their unit.
And for a nurse leader, it might mean leading the implementation of a new electronic health record system.
Providing training and support to their staff. And navigating those challenges that inevitably come with any major change.
And at the CNO level?
It's about fostering that environment where learning and innovation are encouraged.
And where nurses feel supported in taking on those new
And
challenges.
finally, in this world of rapid advancements in healthcare,
Continuous learning is no longer just a nice to have.
it's an absolute necessity.
Nurses need to stay up to date on the latest trends, the newest technologies.
And those evolving best practices in utilization management,
And that means making a commitment to lifelong learning.
attending conferences, reading journals, taking courses.
And finding ways to continuously expand our knowledge and skills.
So how can busy nurses make time for all of this?
Well, it's about finding those small moments to learn.
Maybe setting aside some time each week to read a journal article.
Or attending a webinar or listening to a podcast.
And nurse leaders can really support their teams in this.
By providing access to those educational resources.
And creating a culture where continuous learning is valued and encouraged.
And for the CNO, it's about investing in professional development opportunities for nurses.
And making sure that there's time and support for them to pursue those learning goals.
Absolutely.
Well, we've covered so much ground today.
And I hope this has been helpful for our listeners.
If you'd like to learn more about the future of utilization management and connect with a community of passionate nursing professionals,
We encourage you to visit healthcarenurses.net.
you'll find lots of great resources and information there.
And you can connect with other nurses who are on this journey with you.
Now, as we wrap up, I just want to leave you with one final thought.
By embracing innovation and continuously developing those essential skills,
And always keeping those core nursing values of compassion and patient advocacy at the center of your practice.
you can truly make a difference in creating a healthcare system that is both efficient and effective.
And one that delivers truly exceptional patient-centered care.
And remember, technology is a tool,
It's here to help us.
but it will never replace those essential human qualities of nursing.
The empathy, the compassion, the critical thinking, the problem solving.
Those are the things that make nursing such a special and rewarding profession.
We hope this has been valuable for you in your nursing journey.
And we encourage you to continue exploring those resources and connecting with that amazing community at healthcarenurses.net.
Thank you so much for joining us today on the Healthcare Nurses Network podcast.